So welcome to this final Agora of Wish 2020. My name is Ashley McKim, I'm Editor-in-Chief of BMJ Innovations, and it's a pleasure to be back moderating this session. Thank you to everyone who has joined Nick and myself throughout this week. It's been great to have you with us. This year, the world has been facing a global emergency as we tackle COVID-19. Encouragingly, we're starting to see the light at the end of the tunnel. But for many people, they feel they'll be leaving one global emergency to focus on another, one that can't be solved with vaccines. In this session, we're asking, when will we wake up to the global health threats of climate change? For those who are joining the Agora for the first time, in this session, we invite a panel from across the WISH community to join us to share their thoughts, discuss these key issues, and provide their opinions. We encourage you to do the same via the WISH website and social media, with the hashtag #VirtualWish2020. I'm going to welcome our panel to join us in a few minutes, but first I want to introduce our expert for this session, Dr. Lorenzo Guinta. Renzo is Chief Planetary Doctor of Public Health and Inaugural Director of the Planetary and Global Health Program at St. Luke's College of Medicine in the Philippines. He's also been a member of the Forum on Climate Change and Health of WISH, which advised on the WISH report on this topic. Renzo, thank you for joining us. I want to kick off discussions by asking you to reflect, I think, on some of your personal experience. I know the Philippines has dealt with its own global emergencies recently. So tell us a bit about yourself and a bit about how that's affected your life recently.
Thank you so much, Ashley, for having me in this conversation. And thanks to WISH as well for this opportunity. I'm speaking from the Philippines, a country that is at the heart of the climate crisis. You mentioned a while ago that right now we're fighting COVID-19, this pandemic. Of course, a crisis that is unprecedented and which has affected so many different countries, including mine. But we also need to remember that there's another crisis. In fact, it's not about the first wave or the second wave. It's a tsunami of climate-related health consequences that can happen, that we can expect to occur in the years and decades to come if we do not act now. And thanks for acknowledging the situation that we've just had here in the Philippines. We're battling an infectious disease, a virus that is unseen, but we're also fighting many other natural calamities. Just for the past 2 weeks, we've been visited by 2 super typhoons, and maybe you've seen in social media the pictures of children being carried in buckets because they are floating in inundated cities and municipalities. You've seen people in evacuation centers cramped and actually violating social distancing because there's no other place to stay when your house and your other settlements are being destroyed by these natural calamities. And so these are just some of the climate-related extreme weather events that we are facing now. We're actually expecting, I think, around 4 more before this year ends. And so now we're seeing this compounding of multiple crises, and therefore this will definitely, constrain our ability to meet our people's needs, including health, and also long-term survival. We don't know if, in the coming years and decades, we'll still be able to address these natural disasters in the context of a more, uncertain future where perhaps pandemics will be happening more and more, again, if we don't get our acts together. I'll stop there.
And so it kind of struck me earlier that when we were talking that, COVID has taken a lot of attention of the media and the world over the last sort of 8 or 9 months, and we've missed out a lot of this news as well. I know the WISH report, which people can go and read on the website, started to introduce the sort of challenges we have in global health and climate change. I wonder, can you reflect on the key messages for people who perhaps haven't read the report so far?
Yes, and it's really a deep privilege to be part of the team that conceptualized, that debated, that drafted this landmark report, which I would encourage every participant of WISH to not just read, but also to spread. Let's spread the word, get the word out, to remind the global community that yes, we're fighting a pandemic and we have another crisis and so much more that will need to be tackled in this century. And so we really need to work together. We need to really, invest in healthcare systems that bend but do not break, whether in the context of a pandemic or climate-related extreme weather events or climate-sensitive diseases. So in that report, it's a very good summary of all the health challenges that we will be facing if climate change continues, remains to be unabated. For instance, infectious diseases, the old ones will reemerge, and then new ones like COVID-19 are going to be expected. But it's not just the infectious diseases. We know that in a changing climate, in a warming planet, non-communicable diseases like heat-related diseases, illnesses, stroke, we will expect more ER consults. And as you've seen over the past several months, our emergency rooms are already very overwhelmed because of COVID. We can expect more burden in the years to come if we will have more natural calamities, increasing temperature, heat waves, etc. But also mental health. We always think that, climate change is just about infectious diseases and flooding and typhoons. But our mental health is also very important. And there is increasing evidence that shows that in a more unstable climate, in a warming planet, we can expect what we now call as ecological grief and ecological anxiety. This idea that we don't know what the future holds. We don't know if our, farms will still be able to produce the crops that will put food on our table. We don't know if, the world will still be inhabitable for our children and those that are yet to come. So these are just some of the health challenges. But finally, I think it's not just about the problems. This report also provides us a menu of solutions. And what is innovative about this report is that there is actually a page that you can cut, although, everyone now reads in PDF, but it's a page that you can actually cut. It's called an index card for climate action for health leaders, because we know that climate change can be overwhelming, it's complex, and healthcare professionals who are in the emergency rooms, in the clinics, hospital directors, those who work in the pharmaceutical industry may find it challenging to really comprehend what climate change is going to, bring to our collective health. And so we came up with this index card. It's a list of 10 things, very doable actions, low-hanging fruits, how we can reduce the carbon emissions of our own healthcare systems, our health services, even in the field of anesthesia. Maybe some of our folks are not aware that there are anesthetics that are less climate disruptive, and we need to be using more of them. But also, how do we re-engineer our health services so that we are ready for the next, shock, external shock, whether it's climate related or another pandemic.
Thanks, Renzo. So what I might do is we might bring in our panel now, and then we'll come back to you, I think, for some more questions and comments as we go through. So let's bring our panel in. Just a reminder for people at home, please do continue the discussion on social media and the WISH website. But let's take a moment and bring our panel to the room. So welcome back, everybody. It's really nice to see a great panel in front of us today. Just a reminder for those who haven't been in the panel before that we're going a bit old school. If you've got a question, please raise your hand and one of our moderators will put you on screen and we can take your question. So please raise your hand throughout the conversation if you've got something to ask or something to comment on. We've got probably about 30 minutes for questions. I might come to, I saw one hand coming up already from Mahmood. Maybe we'll go to Mahmood first of all, and then we'll take some questions from the rest of the people on the panel. if not, we'll come back to you in just a second. Mahmood, can you hear us?
Hello. So I have a question to Renzo. As you know, people in different geographical location get affected or can witness the climate change depending on your geographic location. But the question is, how can we convince the people in specifically in the MENA region or the Arabian Gulf to act now?
Thanks for that question. And the MENA region is one of these climate and health hotspots. If you go to these reports, from the IPCC, from the WHO, from the World Bank, the countries in the MENA region are expected to face a lot of health challenges, from water scarcity. In fact, also in this forum, WISH forum, we just launched this report about how do we ensure good health in dry cities. And these cities are expected to become much drier, in a warming planet. And so, climate change in the MENA region, just like in many other regions of the world, it's not anymore fiction. It's not anymore something that we are expecting in, 20, 30, 50 years' time. These effects are already happening now. And I think the way to really convince our leaders, domestic leaders, is one, tell the story of how communities are already being affected. These leaders, politicians, healthcare leaders, they may not be reading these big reports, but definitely if we tell the story of real patients that are already affected by infectious diseases, by malnutrition because of crop failures, I think that's even more powerful. There's power in stories, especially if we complement that with statistics. And also, I think this is a great opportunity to really reframe the conversation. Before, climate change, has always been about, polar bears becoming dehydrated. Of course, we want our polar bears to look healthy. But now it's people. It's about people. And if we really talk about climate change from a public health perspective, I think there's a higher chance that we can mobilize communities and convince policymakers to give this a priority, especially as we're battling a pandemic. Thank you.
Thanks, Renzo. And I think it's been a constant theme throughout this week that actually it is about the people, it's about the patients, and actually whatever level you are in an organization, you can make a difference as well. So I think that's a really, really helpful comment. I'll maybe come to the lady in the glasses next, please.
Yeah, so I just want to ask, did the climate change accentuate this COVID-19 transmission and the pathogenesis and all that? And did it contribute to any surge of cases due to the global warming or something like that? So yeah.
Great question. Thank you, Sukanya. I think the jury is still out when it comes to, is this specific pandemic related to climate change? But one thing is for sure, that in a warming planet, the likelihood of, again, as I've mentioned, new infectious diseases emerging and old infectious diseases re-emerging, that has already been shown both historically and then already projected for the future. And so I will not be surprised if maybe 10, 20 years down the line, we'll look back to year 2020 and the years that followed and say, wow, because the climate has continued to become destabilized, the planet continued to warm, then epidemics have become more and more frequent. Having said that, what we actually don't want to happen is when the predictions of mathematical modelers become true. If they say in the report, oh, in the next 50 years, there'll be a lot of pandemics, right? That we don't want to happen. And so we have this opportunity to actually prevent that from happening. And that is why climate action now, not tomorrow, is critical. Because we don't want to reach 2030, 2050 and say, wow, the predictions have become true because we didn't do our part. We delayed climate action and we've reached a point of no return. So that's my answer. Thanks.
Thanks, Renzo. And I might take this opportunity to bring in Richard Hurley. So Richard was an editor in another BMJ collection that we partnered with Wish on that was looking at infectious disease and climate change. So I just want to follow that up with Richard. Any of your personal reflections on how these two things are linked?
Yeah, thanks very much, Ashley, and thank you so much to Wish. It's the BMJ was very excited to work with Wish on the report. So we produced a report on climate impact and infectious disease, and absolutely didn't know how pertinent that would be because we started before the COVID-19 outbreak. But I mean, the report reflects a lot of the discussion in this session so far. That climate change presents a huge, or the greatest challenge, a current challenge to health. And we've known about these, we know what's coming or what might be coming, and we've known for a long time. And yet the problem seems to be neglected, and absolutely crucial how we can galvanize, awareness, interest, support from the public and from governments and from funders as well. So those are really the conclusions in our report. So we absolutely have to reduce emissions, invest in surveillance and preparedness and response. But we've known all of that for a long time, and it's really the huge question is how do we get people, to governments and policymakers and funders, to act. We're open to hearing the answers to that question.
Thanks, Richard. I might come back to Renzo in a second just to reflect upon that, but any other questions from our panel? Let's take I think there's a lady in the red scarf, I think.
Hi, Renzo, thank you. I'm coming from a medical ethics point of view, and I just wondered whether you thought that the inclusion of words like paradigm shift, does the changing paradigm of global health give us more justification for using, say, nudge techniques or behavioral insights, just trying to change people's behavior in these ways? Is there more justification because of a paradigm shift? What do you think?
Right. Thank you for that. And, I might answer your question from a much broader perspective, trying to bring the ethics. I think now global health's ethics will need to be expanded and revitalized and reoriented towards not just improving the health of people, but also improving the health of the planet. And maybe you've heard of this new concept of planetary health, which basically addresses that, planetary health as this integrated vision for the health of the human civilization and the health of the planet in which we live and thrive. Because for the past century, public health, global health, has improved the health of the world, added 30 years to the average life expectancy, but in many times at the expense of the planet, putting food on the table to improve nutrition without thinking about the carbon footprint, the resources needed to produce food, or increasing urbanization that led to greater prosperity in many countries, both developed and developing, but again at the expense of natural ecosystems, increasing air pollution, so on and so forth, destroying the planet for future generations' health. And so that is the ethical paradigm shift that I actually want to see in global health beyond the nudges. I think there's room for all these tools that we have, the carrots and the sticks and the ones in between. But I think fundamentally the ethical paradigm shift that we need is for us health professionals to really acknowledge our responsibility, not just to our human patients, but to the planet as well. And that's why I would like to invite you. Just 2 months ago, I co-authored this commentary about rewriting or revisioning the Hippocratic Oath we in the Hippocratic Oath, which we recite as physicians, health professionals at the start of our careers, we always say, do no harm to our patients. Now we are expanding that to do no harm to our planet as well, because a sick planet will bring us more sick patients. And so we want to make sure, we're not accomplice to the crime. Thanks.
Thanks for the great question and answer as well. Another question, I saw a lady with the blue wish background behind her.
Question to Lorenzo. This might be a bit far-fetched, but I was really curious to know what is the correlation between adopting basically a vegan lifestyle and sustainability, and that does promoting this type of lifestyle ensure a more climate-friendly future, and what have recent evidence or studies shown with regards to this? Thank you.
Thank you for that question. And it's not a far-fetched idea. It's already a proposal that has been on many people's tables, literally. This idea of shifting the global diet from a predominantly meat-based to a more plant-based diet. Call it veganism, vegetarianism, pescatarianism. There's so many options. In fact, in 2019, there is this report by the Eat Lancet Commission, which introduced the concept of a planetary health diet. Again, an initial, provocation as to how the plate of the future should look like if we really want to achieve healthy people and healthy planet at the same time. The major question is, how do we implement that? How do we execute that? And I know, maybe not in, the Middle East, but in other parts of the world, we still have food cultures that are very, based or rich, in meat and other related animal products. And so that will need to change. But then how do we change culture? How do we change everyday practices and habits? So the technological answer is easy, come up with veggie meat or, laboratory develop meat alternatives. There's a proposal to impose meat taxes. But fundamentally, the transformation that is needed is cultural. And we need to have an open and inclusive conversation in order to realize that transformation. Thanks.
Thanks, Renzo. And I think we've started those conversations this week at Wish, which is fantastic. Let me bring to another question. I think, Faraz, we've got you up in the left-hand corner. Faraz, do you want to ask your question?
Is my mic on? Okay, sure. So I'm glad that Renzo actually brought the changing culture, because something else that was brought up in the report with the cutout about the simple steps was also the fact that taking advice from healthcare professionals and framing climate change as apolitical and more a human health issue tends to take the edge off of it and bridges the bipartisan divide. Now, my question is, there's still a cultural divide, and now that healthcare has been more politicized than ever with the advent of COVID, how do you think that will affect messaging in the future?
Thank you for that question. And when I said that we need to, reframe the discussion around climate change, from a more public health perspective, it is not an invitation to being naive. Fundamentally, we still need to grapple with the political and economic forces that shape these decisions regarding, our energy systems, the food sector, transport systems, basically the economic system. And so we really cannot just stop with, stopgap measures, focusing on the cosmetic, and being reactive, because, for instance, we can, of course, prepare health systems to address future climate-related health conditions. But if we really want prevention on a planetary scale, then we should not be afraid to deal with, again, the political forces, the economic forces, COVID-19, while definitely a very, it's a crisis moment, it's causing a lot of suffering around the world. We've seen in history that every time there's a pandemic like this or a natural disaster or even a war, it's an opportunity for reset. And so what we're not talking about is what is the new economic model that will ensure the achievement of healthy people and healthy planet. And, I've actually just come up with this term, we always say we need more PPEs, personal protective equipment, for our frontliners, but we need another kind of PPE, which is a people and planet-oriented economy, an economy that serves people and planet and not, profits and the greed of, a select few. And that is really a fundamental, echoing what was raised a while ago, paradigm shift that we need. And so, and I think health professionals, because of the COVID moment, we now have this wonderful opportunity, to really voice out, this necessary transformation that is needed to ensure civilizational health in the years, decades, and even centuries to come.
Thanks, Renzo. Any other questions from our panel? Maybe I'll come to Elisa. Elisa, I know you run global health programs all over the world. If you have any reflections or any questions for Renzo?
Yes, thank you, Ashley, and thank you, Wish. Yes, for everything that Renzo said is really true. And from our perspective, we work on healthcare system strengthening programs, so to prepare healthcare workforce. And so we will continue to with this commitment, and we will double this commitment. But at the same time, I think it's very important that we keep into the conversation Ministry of Health and also Ministry of Finance. So they, as you said, it's not just the health, but it's an economic reshuffling of the entire world, really. So we need to bring them into the conversation and make them understand what are the impacts. So thank you very much for bringing this.
Thanks, Elisa. And I think as we discussed earlier in the session that, this is a global challenge on the scale of COVID that we need everybody to come together, governments, NGOs, healthcare organizations and individuals as well. Let me come to the gentleman who's got, I think it's a fantastic painting of Amsterdam in the background, if that's right. But let me come to you for your question or comment.
Yeah, hi. My question is around the fair share of responsibilities. I think the fact on the ground, those countries and islands who produce the least carbon emission are the most affected. How you would address this dilemma? How you can, policymakers and of course, those who are supposed to take responsibility for their own action?
Thank you for your question. And if you go back to our climate, legal instruments, there's this phrase, common but differentiated responsibilities. So every country has an obligation to both mitigate and adapt climate change, but it's differentiated because we know that there are countries that have polluted more than the others. And on the other hand, there are countries that will bear the brunt of climate change and its health effects more than the others. And so it's important to remind, while climate change is a universal issue, it is also an issue of equity and justice because the effects will be unevenly distributed. And we need to keep on reminding, the big countries and the corporates to, fulfill their commitments set in the Paris Agreement and all the other instruments, and even to go beyond that if we want to make sure that the world will remain habitable for generations to come. And so, we want them to honor their commitments. We want them to, support the transition of many developing countries towards green and just economies. And again, the COVID moment as a time for reset is a great opportunity to actually, realize those obligations. Of course, I understand that the COVID pandemic itself has a lot of financial requirements. And so this is really an invitation to creativity. How can we build resilient health systems and economies that are both pandemic resistant, but also climate adapted and climate smart? This is an opportunity. And the other piece is, for instance, of course, we acknowledge that there are countries that are already suffering the brunt of climate change. In fact, Pacific Islands already inundated, at risk of being erased from the face of the earth. We need to have a conversation about how can we help, provide assistance and a dignified aid, not just tokenistic aid. It should be aid with dignity. If these people will need a new place to be relocated to, there has to be a conversation, because climate-induced migration, some call it climate refugees. That is not, something will happen only in the future. That's already happening now. But, the global community is silent when it comes to providing dignified aid, to these people that will need to be, relocated again because of climate catastrophe. So those are just some of my answers. Thanks.
Thanks, great question, and thanks for the answers, Renzo. We've got time for another couple of questions. Anybody who hasn't had a chance to ask a question or make a comment yet, if you want to raise your hand, we'll come to you. Any further questions or comments from our panel? Maybe Renzo, just sort of reflecting back on our conversations from today, do you have any kind of key takeaways? I know a lot of people in our panel today and a lot of people watching will be individual healthcare workers working in healthcare systems or in organizations. Any advice for how they can help participate in this? As we said, it's a global effort to kind of help to tackle this crisis. What can individuals do working in healthcare systems?
And thanks again for that question. Of course, we need to acknowledge the hard work and the sacrifice of all the health professionals that are in the front lines, those in the decision-making tables, those that are making sure that we are safer than yesterday, from COVID-19. We need to acknowledge that, and we need to make sure that they all receive the support that they need until we finish this pandemic and as we confront future challenges, such as the ones that we already mentioned. But also, I think, and this is my, clarion call to my fellow health professionals, but also to all professionals. I think, in the time of COVID, we are all realizing we're all health professionals at the end of the day. You may be an engineer or a lawyer or an architect or a social worker, but all of us are in the business of improving people's health. And therefore, addressing climate change, preventing further, warming of the planet should also be part of our everyday business. And that means, and taking advantage of the COVID moment, we need to speak up. We need to tell the story of our patients who are already affected in MENA, in many parts of the world. We need to start walking the talk, practicing what we preach, start, adopting sustainable practices in healthcare service provision, in other sectors like food and transport and agriculture, as I've said, and energy. And ultimately, we need to start the real serious conversation about the future that we want in terms of global politics and the global economy. We still have the Sustainable Development Goals that need to be achieved. And COVID-19 has made the achievement of the SDGs much more difficult. And then we also have the climate crisis. And by the way, we talk about climate change, but from the lens of planetary health, there are also other global ecological crises that, will be affecting our health, in addition to climate change, biodiversity loss, the destruction of our oceans, air pollution, rapid urbanization, et cetera, and et cetera. We need to address all of these health issues. And so we need planetary health in all policies. And so how do we do that? And finally, this conversation might have been might have caused a bit of despair, adding to the despair that we're already facing in the time of COVID, but it's not a gloom and doom story that we really want to tell. It's a story of triumph, of hard work, of victory. But it will only happen, that narrative will only be written if us, in the panel, those who are listening and those who will be hearing the lessons from this conversation will really play their role, will act now, not tomorrow, and will work together for the achievement of a healthier future for our people and our planet.
So thank you, Renzo. You've touched on a lot of the challenges we're going to face. I want to ask you a difficult question, which is how optimistic are you that we can tackle this? And when do you start to think we'll start to see the fruits of the labor to tackle the climate change problem?
Sense the optimism and hope in the way I talk about these issues. And I've become much more optimistic because I'm surrounded with by amazing individuals. I believe a lot of you are health professionals asking these important questions. And now the planetary health army is much bigger because of you. And I'm really rooting for you to act and spread the word. If there's one virus that we should be spreading, that is the virus of planetary health. This virus, this idea that we need to live in harmony with nature. We need to change, again, going back to the paradigm shift, we do not own nature. We are just part of this fabric of life. And that, that should be a call to humility, call to, action, call to greater respect, for nature. And if we respect nature, it will respect us back and will make sure that the planet is more conducive for health and well-being in the future. So I'm optimistic, but that optimism, is only as high as the number of people that will really commit to do their share and to be part of this growing movement for transformation.
Thanks, Renzo. I'm going to just check if we've any final questions from our panel. If anybody's got a final question, please raise your hand. Otherwise, Renzo, I'm going to come back to you in a second just to finally sum up and give us some advice to take away. But let's go to Faraz. I think Faraz has got one final question, and we'll come to the lady as well with the blue curtain behind her. Faraz, first of all, from you.
So, yeah, I'm glad you brought up the notion of us all being health professionals in the wake of this incoming crisis. Now, my question to you is, how can health professionals or people within the healthcare system empower people outside the healthcare system to pressure governments resistant to change to actually take this problem seriously?
I think we don't need to empower other people. I think there's innate power in every person. And I think what we need to do is to really work with other sectors, with other professionals. And as we increase our tribe, then there's power in number. And therefore, we'll be able to hopefully drive, significant policy change at all levels, whether it's local, national, regional, or global. Having said that, going back to my earlier message, I think we health professionals have a very powerful message to share. Unfortunately, not many of us are speaking. Not many of us are really articulating, these messages, from researchers who are stuck in the journals to, and sorry, BMJ for that, but also to colleagues who may be very busy in the clinical world. And we need to really step out of our comfort zone to make sure these messages are being amplified. So that is what we need. And again, we have this wonderful opportunity of COVID. Health now is at the top of mind of every person in the world. It's front page of every newspaper. And so there's no better time to really emphasize the importance of healthy people and healthy planet than now.
Thank you. Great question, great answer. Let me come to the lady in with the blue curtain behind her.
Hello. I have a question regarding the developing countries. How do we actively involve the massive numbers of uneducated people who don't have access to all these great information? How do we actively involve them in these conversations, knowing that they don't have, access to
Thank you for your question. Can you hear me now?
Yes.
Okay. So thanks for
Yes, we
that
can.
question,
Yes,
and
we can.
thanks for raising the importance of education. We cannot ignore that there's still a global education divide that we are facing, and unfortunately, the COVIDization of education will probably exacerbate that divide, widen that gap. Not everybody can participate in sessions such as this because of limited internet connectivity. And so we really need to address education. And this is, again, I'm looking at it as an opportunity. We need to work with the world's educators, and we need education to be adaptive to climate change and to all these other environment and health threats. And actually, just recently, I also co-published an article speaking about, the need to incorporate planetary health in the education of not just health professionals, not just university students, but children. Because if we really want a new generation of planetary health stewards who will be leading and governing, in the next not just years, but century, then we need to start early. And so this is a great opportunity to work with the education sector to address climate change and also to raise the level of literacy around the world.
Thank you. Great question. Renzo, we're nearly out of time. Can I just ask you maybe to kind of summarize a few final closing remarks from people who are joining, and then we'll end the session.
Well, thank you very much again for this opportunity. And, it's hard to summarize so many, problems and also solutions. But I think that's the summary. Yes, we are confronting a lot of these existential threats, to humanity, ecological nature, but also induced by many of our activities. And that's why, there's this term, we now live in this era of the Anthropocene, where humanity is the biggest force that is shaping and changing, the face of the earth. And so we need to acknowledge that we are actually contributing to this, to the ill health, not just of our people, but also of our planet. And that is why, we need accountability. We always romanticize, the people are resilient, they can recover from the crisis. But as more of these crises happen, again and again, because of climate change and other forms of planetary damage, then we need to rethink, no, it's not about resilient people. It's actually about accountable and responsible governments and businesses and the health sector, health professionals, people. And so if we, embrace this obligation that we have, then we will be changing, the conversation. We will be changing the types of solutions that we will be considering, because the solutions that we need are truly the ones that, address the root causes. Again, going back to my idea of a people and a planet-oriented economy, I hope that our community will start, imagining that positive future. Thank you.
So I'm afraid that's the end of our Agora. Thank you, Renzo, for all the fantastic discussion. Thank you again to all our panelists. Just a reminder, there's still a packed final day of WISH 2020 ahead. Make sure you get a chance to check out the Innovation Hub in the networking area, but be back in the main theatre in just under 15 minutes for a session on the role of schools in child and adolescent health. Thank you and enjoy the rest of the day.